Let me just say our team, Dr. Toomey, the other folks that will be joining the town hall tonight have done a tremendous job of keeping me informed and helping the local communities. We continue to be in touch with communities all across this state. We continue to work with our task force, which has just the brightest of minds in our state, people from Emory and other healthcare facilities and Georgians that are close to this pandemic that we're dealing with. So I've gotten a lot of great advice, and I'm making decisions based on that advice. But I'm having to govern the whole state. It's much different than certainly what Mayor Bottoms and other local elected officials have done. I've been in discussions with all of them about ways to handle this. I'm supportive of the actions that they're taking, much like the President and the Vice President are doing. We're following their advice of Dr. Birx and Dr. Fauci as well, and they are supporting the nation's governors who have all taken different tacks to deal with this virus. But, you know, the day that, or Monday, I guess it was, when we did the recent order with closing bars and restaurants, sheltering in place the elderly and medically fragile, and locking down events with 10 people or more unless there were social distancing parameters in regards to that. I was also talking to local elected officials in parts of our state that have not even had a single case yesterday, as of that time, and we still have over 50 counties that don't have a confirmed case yet. So, you know, trying to balance all those things, continuing to go on the data that we have, and supporting local elected officials. I did that in Albany. I asked over a week ago if they wanted me to take action to help them with the hot spot we have down there. They asked me not to do that. They wanted to handle that locally. A week later, I was on a call with all the local elected officials, not only in Dougherty County but surrounding counties, as they all came together to take action. And we have a lot of resources on the ground down there. But that's why I've made the decisions that I've made. I still have arrows in the quiver, if you will, if things get worse. But my case tonight to Georgians is, if you will help us stop the spread, continue to fulfill the 15 days that the President, the Vice President, and the National Task Force to stop the spread. We've got a few more days to go. We have about 10 days to go on the recent action I took. There's a lot of great things going on at the local level. If we can get our citizens to follow these directions, it will absolutely turn this curve. We can get on the other side of this virus, and it's critical that we do that for our healthcare system. We are in contact with them daily, our hospitals across the state, working to procure supplies that they need, whether it's ventilators, PPE material, extra beds that we're preparing for, you know, if and when a surge occurs. So, you know, all of those things, but it's really up to the public to cut down on the number of people that we have to go to the hospital, and we do that by what I targeted in my order, and that was to protect the elderly and the medically fragile. That is the key to this right now.